Friends, how many of you would want to be fit at 40, healthy at 60, and independent at 80? How many of you understand that food and obesity have a role to play in all of this? I am Dr. Vijaita Syngle, and today I am going to be speaking about obesity and how it is a major risk factor for diabetes. To put it simply, obesity is when you have more body fat than is healthy. According to WHO, 2 billion adults are overweight, out of which 650 million are affected by obesity. In India, obesity has already reached epidemic proportions. Did you know that obesity is not only a disease, but it is a cause of many preventable diseases like heart disease, diabetes, liver disease, and cancer, which are responsible for over 70% of deaths worldwide. So it would not be wrong to say longer the waistline, shorter the lifeline. At this point, it becomes important to understand that obesity not only impacts but is the strongest risk factor for developing diabetes. The most prevalent form being type 2 diabetes with the incidence of more than 95%. Worldwide, the epidemic of obesity has led to the epidemic of diabetes. India has the dubious distinction of being the diabetic capital of the world. Diabetes is a condition in which your body cannot use food like it should, and therefore blood sugar levels are higher than normal. According to the scientific theory, obesity is thought to trigger changes to the body's metabolism. These changes cause fat cells to release fat molecules as well as pro-inflammatory chemicals into the blood. These two factors lead to decreased insulin sensitivity, also known as insulin resistance, the hallmark of type 2 diabetes. By now, we understand that there is a firm and definite link between obesity and type 2 diabetes. However, the good news is that reducing your body weight by even a small amount can help improve your body's insulin sensitivity and therefore improve blood sugar levels. Also, it will lower your risk for diseases like diabetes, blood pressure, and heart disease. The increasing incidence of both diabetes and obesity makes the management of these related conditions particularly important. Since obesity is one of the most visible yet the most neglected risk factor, let us look at the various factors which play a role in how much you weigh. The type of food you eat, how active you are, your family history, your sleep habits, certain medicines, feeling stressed or having depression, and certain health problems like hypothyroidism. It is important to seek the guidance of a certified obesity consultant who can help you lose weight scientifically. Do not fall into the trap of fad diets or unhealthy dieting. You also need to play an active part in taking care of diabetes because these small steps will go a long way to prevent diabetes. First of all, find out if you are at risk of diabetes. Check out your family history. Lose a small amount of weight. Be more physically active. Make healthy food choices. Choosing what, how much, and when to eat is very important. Record your progress and be consistent. Remember, it takes time to make new habits, but your patience and persistence will pay off in the long run. Till then, stay happy, stay healthy. Thank you.